Hello parents, myself Dr. Anupriya. In this course, we'll learn about the ABC of safe sleeping practice. So, the objectives would be importance of safe sleeping practice, ABC of safe sleeping practice, importance of setting a sleep routine, room sharing versus bed sharing, and safe sleep under special circumstances. So first, let's learn the importance of safe sleeping practice. So it helps in reducing the risk of sudden infant death syndrome, that is SIDS. So SIDS is nothing but sudden, unexplained death of an infant below 1 year of age. Safe sleep practices are the most efficient way to minimize the risk. So this safe sleep practice helps your baby to establish a healthy sleep pattern that can benefit your baby in their overall well-being. Consistent safe sleep routines can help your baby to fall asleep and maintain their sleep. Emphasize that the safe sleep practices are not only to reduce the risk but also to create an optimal healthy sleep environment for your baby's health and development. Now coming to the ABC of safe sleep. So A stands for alone. So baby should be sleeping alone in his or her sleeping space. This means no other people, bedding or objects in the crib. Avoid co-sleeping, that is sleeping along with your baby, as it increases the risk of SIDS and other sleep related problems. However, room sharing is recommended, that is you and your baby sleep in the same room but on different beds. The B stands for back. Always place your baby on their back to sleep for naps or nights. This is the safest position and significantly reduces the risk of SIDS. Once your baby starts rolling over consistently from back to front or front to back, you can let them sleep in their own comfortable position. However, always place them on their back to start with. C stands for the crib. So use a flat, firm sleep surface such as a safety approved crib or a bassinet. The mattress should fit snugly and there should be no gaps between the mattress and the crib sides. Avoid soft bedding such as a pillow, blanket, kilt. These can increase the risk of suffocation, entrapment, overheating. Importance of setting a bedtime routine. So, firstly, you need to have predictable and consistent activities. So, establish a bedtime routine so that it signals your baby that it's time to sleep. So this can include a bath followed by a massage and then reading a book. So calming and relaxing environment. Create a peaceful and quiet environment in your baby's room. Dim the light, minimize the noises, and ensure that the room is at a comfortable temperature. Keep the routine short and consistent, maybe around 20 to 30 minutes, and always start at the same time every day. This will ensure that your baby's circadian rhythm is set and hence the sleep will follow in. You can choose the activities that you enjoy and are calming for your baby. Now, bed sharing versus room sharing. So the American Academy of Pediatrics recommends that the baby sleeps in the same room as the parent but on a separate bed that is specifically designed for babies like cribs or bassinets for at least the first 6 months, ideally 1 year of age. Now, co-sleeping versus room sharing. So what is co-sleeping? In co-sleeping, the baby sleeps on the same surface or bed as the parent. But in room sharing, the baby sleeps in the same room as the parent but on a separate bed. That can be a crib or bassinet which is specifically designed for babies. So why room sharing and not bed sharing? So the American Academy of Pediatrics recommends room sharing as it minimizes the risk of SIDS. Room sharing allows easy access for babies feeding, comforting and monitoring while providing a safe, separate sleeping surface. Why co-sleeping is generally discouraged? Co-sleeping significantly increases the risk of SIDS and other sleep-related deaths such as suffocation. So the baby may get suffocated with any soft bedding, pillows, blankets, or if the parent rolls over onto them. Entrapment. The babies may get trapped between the mattress and the headboard or the wall. Overheating. Adult beds are often warm and can lead to overheating. Co-sleeping is particularly dangerous in the following situations, like parents who smoke, who have consumed alcohol or are taking medications that can cause drowsiness, parents who are excessively tired, babies who are born premature or are of low birth weight, babies who sleep on soft surface like sofa. Safe sleep in special circumstances. So firstly, for premature babies, such babies may have unique sleep needs and may require monitoring. So you need to follow the recommendations given by your baby's neonatologists or pediatricians. Babies with reflux. So discuss the strategies for managing reflux in sleep. So elevating the head end of the crib while asleep and feeding your baby upright. Emphasize that babies with reflux should always sleep on their back while traveling with the baby. So provide tips to maintain safe sleep practice even while traveling, such as portable cribs, and follow the ABCs of safe sleep. Discuss the strategies for adjusting to different time zones and different sleep environment. So, make sure that your baby is sleeping alone on a separate bed, that is room sharing and not co-sleeping. Baby sleeps always on the back and on a flat firm surface. Follow these guidelines.